What would you do if you felt a crushing pain in your chest right now and you were completely alone? That cold sweat, the shortness of breath, the fear that grips you as you realize, this could be it. It's a terrifying thought, one that keeps many of my patients up at night. But what I want you to understand is that what you do in the first 10 minutes can literally be the difference between life and death. Today, we are not going to talk in hypotheticals. We are going to create a clear, step-by-step plan. This isn't about panic, it's about preparation. My name is Dr. Robert Clark, and for over 3 decades, I've been helping seniors navigate the most challenging moments of their health journeys. I've seen firsthand how knowledge and a calm, decisive plan can turn a potential tragedy into a story of survival. We're going to walk through this together, so that if this moment ever comes, you are not a victim of circumstance. You are the person in control. Before we talk about what to do, we must be absolutely certain we know what we're looking for. A heart attack, or what we doctors call a myocardial infarction, isn't always the dramatic, clutch-the-chest collapse you see in movies. In my practice, I've seen it present in so many different, subtle ways, which is why it's often tragically dismissed as something else. The classic symptom, of course, is that feeling of pressure, tightness, or a squeezing pain in the center of your chest that can last for more than a few minutes, or that goes away and comes back. Many patients describe it as an elephant sitting on their chest. This pain can radiate, traveling down one or both arms, most commonly the left, or into your back, neck, jaw, or even your stomach. You might also experience a profound shortness of breath, as if you've just run a marathon without moving an inch. A cold sweat, nausea, and lightheadedness are also very common companions to this chest discomfort. But here's a critical point I need everyone to hear, especially the women watching. For women, the symptoms can be far more subtle and confusing. I had a patient, Margaret, a vibrant 72-year-old, who came to me weeks after she had what she thought was a bad case of the flu. She described overwhelming fatigue that left her unable to even walk to her mailbox, shortness of breath, and a nagging pain in her upper back between her shoulder blades. She never had that classic chest pain. It was only when her symptoms didn't go away that we ran an EKG and blood tests, which revealed she had indeed suffered a significant heart attack. Her story is a powerful reminder that symptoms like unusual fatigue, indigestion-like pain, dizziness, and anxiety can be the primary signs for women. Similarly, for my patients with diabetes, nerve damage can sometimes blunt the sensation of chest pain, meaning their first sign might be sudden weakness, confusion, or severe shortness of breath. The key takeaway is this: listen to your body. If something feels profoundly wrong, unusual, and sudden, you must not ignore it. Ask yourself, is this a new feeling? Is it intense? Does it feel serious? Trust your intuition. It's far better to call for help for what turns out to be severe heartburn than to ignore the warning signs of a heart attack. Don't try to be a hero. Don't wait it out. Your body is sending up a flare, a warning shot from your heart, and the time to act is now. Now that you recognize the signs, the very next second is the most critical. This is where a single, decisive action can alter the entire course of events. This step is immediate, it is absolute, and it is non-negotiable. Before you do anything else, before you look for an aspirin, before you call a family member, before you even think about your car keys, you must call 911. I cannot stress this enough. In my decades of practice, the single biggest mistake I've seen people make in this situation is delaying this call. The impulse to drive yourself to the hospital is a particularly dangerous one. I understand it, it feels proactive, like you're taking control, but it is a gamble with your life. Let me tell you about a patient of mine, a wonderful gentleman named George. George was a fiercely independent former Marine who lived just 5 minutes from the hospital. When he felt that classic chest pain, his first thought was, I can get there faster myself. He grabbed his keys, got in his car, and started driving. 2 blocks from his home, the pain intensified, his vision blurred, and he lost consciousness at a red light. His car rolled into the intersection, causing a minor fender bender. By the time another driver called 911 and the paramedics arrived, precious time had been lost. Time that the ambulance could have spent driving to him was instead spent navigating to a car accident. George survived, but he lost a significant amount of heart muscle, which impacted his quality of life for years to come. His story is a stark illustration of a vital truth. The hospital is not just a building. It's a system of care that begins with that 911 call. When you call 911, you are not just summoning a ride. You are activating a mobile emergency room unit that comes directly to you. Paramedics can perform an electrocardiogram right there in your living room, transmitting the results to the emergency room doctor before you even arrive. This allows the hospital to assemble the cardiac catheterization team, so they are waiting for you the moment you come through the doors. They can administer oxygen, start an IV line, and give you clot-busting medications. Most importantly, if your heart should stop, if you go into cardiac arrest, they have a defibrillator and the training to restart it. Your car has none of that. Remember this phrase: time is muscle. Every minute that passes during a heart attack, more of your heart muscle is being deprived of oxygen and is dying. The care provided by paramedics in the field is designed to stop that process as quickly as possible. When you speak to the 911 dispatcher, be clear and calm. Say the words, "I think I am having a heart attack." Give them your exact address, and if you live in an apartment building, provide the apartment number and any entry codes. Stay on the phone with them. They are trained to provide instructions and keep you as calm as possible until help arrives. I know some of you may hesitate, thinking, what if it's just indigestion? I don't want to be a bother. Let me be perfectly clear, as your doctor, you will never be a bother. We in the medical community would rather respond to 100 false alarms than miss one real one. Making that call is the single most important decision you will make. It is the first link in the chain of survival. Do not break it. You've made the most important call of your life. Help is on the way. While you are on the phone with the dispatcher or immediately after you hang up, there is a second crucial step you can take. It involves a simple, over-the-counter pill that most of us have in our medicine cabinets: aspirin. But how you take it and when you take it can have a profound impact on the outcome of a heart attack. If you are not allergic and have not been told by your doctor to avoid it, I want you to find one regular-strength 325 milligram aspirin. Now, this next part is absolutely vital. I want you to chew it and then swallow it. Do not just swallow it whole with a glass of water. Let me explain the science behind this in simple terms. Most heart attacks occur when a plaque deposit in one of your coronary arteries ruptures. Your body's natural defense system sees this rupture as an injury and sends tiny blood cells called platelets to the scene to form a clot and plug the hole. The problem is, this life-saving process in the wrong place can form a clot so large that it completely blocks the artery, cutting off blood and oxygen to a part of your heart. Aspirin works by making these platelets less sticky. It essentially interferes with their ability to clump together and form a clot. By chewing the aspirin, you are kickstarting this process in the fastest way possible. The medication is absorbed directly through the rich blood supply in the lining of your mouth and under your tongue, entering your bloodstream almost immediately. It can begin to work in as little as 5 minutes. If you were to swallow it whole, it would have to travel down to your stomach and through your digestive system, which could delay its effects by 20 or 30 minutes. In the middle of a heart attack, that is a lifetime. You want to use uncoated aspirin if possible. The enteric-coated or safety-coated kind is designed to dissolve slowly in the intestine to protect your stomach, which is the exact opposite of what we need in this emergency. If all you have is low-dose or baby aspirin, you should chew and swallow 4 of them to get close to the recommended dose. Now, let's talk about who should not do this. This is just as important. If you have a known, true allergy to aspirin, do not take it. If you have a bleeding disorder or have been explicitly told by your doctor to never take aspirin for any reason, then you must follow their orders. A common question I get is from patients who are already on a daily blood thinner like warfarin, Eliquis, or Xarelto. The general medical consensus is that the benefit of chewing an aspirin during a suspected heart attack still outweighs the risk, as it works on a different clotting mechanism than most of these drugs. However, the best course of action is to ask the 911 dispatcher or the paramedics as soon as they arrive. They can give you the final word based on your specific situation. This simple act is not a cure. It will not stop the heart attack on its own, but it is a powerful intervention. It can help keep the clot from growing larger, preserving precious heart muscle while you wait for the true lifesavers to arrive. All right, you have done two of the most critical things possible. You have activated the emergency response system, and you've taken a medication that can help limit the damage to your heart. You have done the hard part. Now, your next job is to transition from action to preservation. What you do with your body in these next few minutes while you wait is an active part of your survival strategy. It's about reducing the strain on your heart to the absolute minimum. My immediate instruction is to stop moving. Do not pace the room. Do not walk to the window to look for the ambulance. Do not try to tidy up or gather your things. I want you to sit or lie down. But the position is very important. The best thing you can do is get into what we in the medical field call a semi-recumbent, or head-up position. In simple terms, this means sitting down and leaning back, ensuring your head and shoulders are elevated above the level of your heart. The easiest way to do this is to sit on the floor and lean your back and head against a wall or a sofa. If you can, grab a pillow or two to place behind you for support. A comfortable armchair or recliner is also an excellent choice. You may feel an instinct to lie down flat on your back, but I strongly advise against this. Lying flat can cause the fluid in your body to redistribute to your chest, which can put more pressure on your heart and lungs, often making that feeling of breathlessness even worse. Keeping your head and shoulders elevated uses gravity to your advantage. It helps to reduce the volume of blood returning to the heart all at once, which in turn decreases the heart's workload. Think of your heart as an engine that is currently struggling and running on fumes. The last thing you want to do is press the accelerator by making it work harder. Any physical activity, even just standing or walking, requires your heart to pump more blood to your muscles. Sitting in a supported head-up position is like putting the engine in neutral. It allows your heart to use its limited oxygen supply for its own survival. I had a patient once, a lovely woman named Eleanor. She had a heart attack while home alone. She made the 911 call, chewed an aspirin, and then, remembering a conversation we'd had, she went to her favorite living room armchair, sat down, and propped her head up with a cushion. She consciously focused on taking slow, calm breaths. When the paramedics arrived, they noted how calm she was. Her vital signs, while clearly indicating a heart attack, were more stable than they often see in a frantic patient. Her simple, deliberate act of positioning her body correctly made a tangible, positive difference in her initial condition. While you are in this position, do one more thing for yourself. Loosen any tight clothing. If you're wearing a tie, take it off. Unbutton the top button of your shirt. Loosen your belt or the waistband of your pants. Anything that feels restrictive around your neck, chest, or waist can contribute to feelings of panic and make breathing more difficult. This is not a passive act of waiting. This is an active process of energy conservation. You are protecting that precious heart muscle. You have handed the emergency over to the professionals, and now your only task is to provide them with the best possible canvas to work on when they arrive. Type Continue to receive the next section. You are in a safe position, conserving energy, and the sound of sirens is hopefully getting closer. Your focus now shifts from your own body to your environment. Everything you do from this point forward is about one thing: helping your rescuers help you. You want to remove every possible obstacle and delay that stands between them and you. These are not bonus tips. These are integral parts of an efficient and successful rescue. The first and perhaps most important is this: If you are physically able to do so without straining yourself, get up slowly and unlock your front door. Let me tell you why this is so critical. I had a patient named Frank who lived in a very secure apartment with a heavy deadbolt. When he called 911, he was in too much pain to get up again to unlock it. The paramedics arrived within 6 minutes, but they couldn't get in. They had to call the fire department to come with tools to force the door open. Those 7 minutes that they stood in the hallway, 7 minutes that felt like an eternity to Frank, were 7 minutes they could have been by his side, administering oxygen, giving medication, and stabilizing him. Contrast that with another patient who, after calling 911, simply turned the lock on her door and sat down right next to it. The team was able to walk right in, without a moment's hesitation, and begin care immediately. If you cannot get to the door, do not risk your health by trying. Rescuers will find a way in. But if you can unlock it, you are shaving critical minutes off the timeline. After unlocking the door, if you had to move, return immediately to your seated, head-up position. The second action is to keep your phone with you. Have it in your hand or on the floor right beside you. The 911 dispatcher may need to call you back for an update or to give you further instructions. Your ability to answer them is key. Now, let's talk about information. In a moment of crisis, it's nearly impossible to remember the names and dosages of all your medications. So, if your daily pills are nearby in a pill caddy or a basket, and you can reach them without getting up and walking around, pull them close to you. When the paramedics arrive, simply handing them your medications is like giving them your entire medical history in a bottle. It tells them instantly if you're being treated for high blood pressure, diabetes, or high cholesterol. It is infinitely more accurate than relying on memory under duress. This brings me to a piece of advice I give all my patients, something I want you to do as soon as this video is over. Take a single sheet of paper and on it, list your full name, date of birth, major medical conditions, any and all allergies, and the name and phone number of your emergency contact and primary doctor. Stick this sheet to your refrigerator with a magnet. Paramedics are trained to look on the fridge for exactly this kind of information. It is a silent but powerful communicator when you may be unable to speak clearly. Finally, if you have a pet, please consider them. An anxious dog, even a very friendly one, can interfere with the medical team's equipment and movement. If you can easily and calmly direct your pet into a bathroom or bedroom and close the door, it helps create a clear and safe workspace. Every one of these steps is about streamlining the process. You are saving seconds that add up to minutes, and minutes are what save heart muscle. You are an active partner in your own rescue. We've now covered all the physical steps, recognizing the symptoms, calling for help, taking aspirin, and getting your body and your home ready. But there is one other incredibly powerful force at play during a heart attack that we need to address directly. It has the one symptom that can be just as dangerous as the clot in your artery: pure, overwhelming fear. I need you to understand that the terror you might feel is not just an emotional response, it has a profound physical impact on your body. When your brain senses a life-threatening danger, it triggers the fight or flight response, flooding your system with hormones like adrenaline and cortisol. These hormones are designed for survival in the wild. They make your heart pound faster and harder, they increase your blood pressure, and they constrict your blood vessels, all to prepare you to either fight a predator or run from it. But in the middle of a heart attack, this ancient survival mechanism becomes your enemy. It is like pouring gasoline on a fire. The adrenaline forces your already struggling heart to work even harder, dramatically increasing its need for the very oxygen it is being starved of. This is why gaining control of your mind is not a trivial matter. It is a critical medical intervention that you, and only you, can perform. So, how do you do it? You do it with your breath. I want to teach you a simple technique that I share with all my patients for managing moments of high stress. It's often called box breathing, and it is used by everyone from Navy SEALs to surgeons to stay calm under pressure. It's easy to remember. I want you to inhale slowly through your nose to a count of 4. 1, 2, 3, 4. Now, hold that breath for a count of 4. 1, 2, 3, 4. Next, exhale slowly and completely through your mouth for a count of 4. 1, 2, 3, 4. And finally, hold your breath with your lungs empty for a final count of 4. 1, 2, 3, 4. Then, you simply repeat the cycle. In for 4, hold for 4, out for 4, hold for 4. This rhythmic breathing does something remarkable. It directly stimulates a large nerve called the vagus nerve, which acts as the main control switch for your parasympathetic nervous system, your body's built-in rest and digest system. It is the biological off switch for panic. Activating it helps to slow your heart rate, lower your blood pressure, and break the vicious cycle of fear. Another powerful tool is a simple, anchoring statement. The loop of panic in your head might be screaming, "I'm going to die." You need to interrupt that loop with the truth. I want you to say this out loud, right now, as you wait for the ambulance. I have called for help. Help is on the way. My only job now is to breathe and to rest. Repeating this either out loud or in your head grounds you in the positive actions you have already taken. It turns your focus from the what if of the future to the reality of the present. You are not helpless. You have taken control. You have made the right calls. Managing your fear is not about being fearless. It is about acknowledging the fear and then using these simple but powerful tools to prevent it from harming you further. You are building a bridge of calm for yourself, a bridge that you will wait on until the professionals arrive to carry you the rest of the way. Now, whether you are watching this video because you've had a heart scare in the past, or you're watching because you want to be prepared for the future, I want to shift our focus for a moment. We've spent this time together building an emergency plan, a reactive strategy for the worst-case scenario. But the most powerful medicine of all is prevention. A heart attack is a terrifying event, but for those who survive it, it can also be a profound wake-up call. It is the body's loudest and most urgent alarm bell, signaling that the way things have been going is no longer sustainable. The good news, and I truly want you to hear this, is that the human body has a remarkable capacity for healing, and it is never ever too late to make changes that can dramatically improve the health of your heart. I think of my patient, Arthur. At 68, he had a minor heart attack. He wasn't dramatically unhealthy, but he carried an extra 30 pounds, his blood pressure was creeping up, and he managed the stress of his small business by eating fast food. His heart attack wasn't the end of his story, it was the beginning of his new one. He decided right then that this was not how his story would end. He didn't do anything drastic. He started by walking to the end of his driveway and back. The next week, he walked around the block. A month later, he was walking for 20 minutes every single morning. He swapped his daily soda for sparkling water. He learned the box breathing technique we just discussed and used it when he felt his stress levels rising. A year after his heart attack, Arthur had lost the weight, his blood pressure was perfect, and he told me he had more energy than he'd had in 20 years. He turned a moment of crisis into a catalyst for transformation. The path to a healthier heart rests on 4 main pillars, and none of them require you to completely upend your life. The first pillar is, know your numbers. You cannot manage what you do not measure. This means seeing your doctor regularly to check your blood pressure, your cholesterol levels, and your blood sugar. These are often called silent killers because they can damage your arteries for years without causing any symptoms. Knowing these numbers is the first step toward controlling them with lifestyle changes or, if necessary, medication. The second pillar is, move your body. This doesn't mean you need to start training for a marathon. It means finding a form of movement you enjoy and being consistent. For many of my senior patients, this is a brisk 30-minute walk, water aerobics, gardening, or Tai Chi. The goal is to get your heart rate up gently for about 150 minutes per week. The best exercise is the one you will actually do. The third pillar is fuel your engine. Think of food as the fuel that runs your heart. A diet rich in fruits, vegetables, lean proteins like fish and chicken, and healthy fats like those in avocados and nuts can reduce inflammation and protect your arteries. You don't have to be perfect. Start with one simple swap. Replace one unhealthy snack with an apple. Use olive oil instead of butter. Small, consistent changes have a massive cumulative effect. And the final pillar is manage your stress. As we discussed, chronic stress takes a physical toll on your heart. Find healthy outlets for it. This could be connecting with friends, engaging in a hobby you love, spending time in nature, or practicing mindfulness or prayer. Taking care of your mental and emotional health is a non-negotiable part of taking care of your heart. These steps are not a punishment. They are an incredible gift you give to yourself and to the people who love you. They are a declaration that you are in charge of your health. We began this conversation together facing a frightening question. What would you do if you had a heart attack while you were all alone? My goal today was to replace that fear with a clear, confident, and life-saving plan. Knowledge is the antidote to panic. Let's quickly review the critical steps, the pillars of your personal emergency response plan, so they are cemented in your mind. First, and most importantly, call 911. This is the immediate, non-negotiable first action. It is the master key that unlocks the entire chain of survival. Do not call a loved one first, and do not ever attempt to drive yourself. That single call brings a mobile emergency room to your doorstep. Second, chew the aspirin. If you are able and it's safe for you, chewing one 325 milligram, uncoated aspirin is your first act of medical intervention. It makes your blood platelets less sticky and can stop the dangerous clot from growing, buying precious time and saving heart muscle. Third, position your body to preserve your heart. Stop all movement. Sit down in a supported head-up position to reduce the workload on your struggling heart. Loosen tight clothing and allow your body to be as still and relaxed as possible. You are actively protecting that vital organ. Fourth, prepare for arrival. You are a partner in your own rescue. If possible, unlock the door, keep your phone nearby, and have your medications ready. You are clearing the path for your rescuers so they can focus entirely on you the second they arrive. And finally, fifth, control your mind. Remember that panic is the heart's enemy. Use slow, deliberate breathing, like the box breathing technique, to calm your nervous system. A calm mind supports a struggling heart. These steps transform you from someone who is simply waiting for help into an active participant in your own survival. But this plan is not just for you. The information we've discussed today has the power to save the life of someone you know, your spouse, your brother or sister, your best friend, your neighbor down the street. We are all part of a community, and we have a responsibility to look out for one another. That's why my final request of you is perhaps the most important. I ask you to please share this video. By clicking that share button, you are not just sharing a link, you are sharing a plan. You are equipping someone you care about with knowledge that could protect them in the most vulnerable moment of their life. You have the ability, right now, to place this vital information into their hands. It is a simple act that could have the most profound consequences. Thank you for taking this time to invest in your health and your preparedness. It is a true privilege to be your guide on this journey. Be proactive, be prepared, and be well.